We're going to move into flexibility work, coming over to the wall, into a wall pec major stretch, stretching your dominant arm out into a T, keeping a soft bend in the elbow as to not pull on the ligaments, but stretch the muscles. We'll twist away, retract our chin here, exhaling the air out. Again, inhale laterally, brace the abs, retract the chin, exhale, and twisting a little deeper. Again, inhale, brace the abs, retract the chin, exhale to twist. Doing great work. Inhale, prepare, brace the abs, exhale, twist. Move your arm into a W or V position. If you took the full class, do the variation you did not do against the wall or on the floor, lying supine on the roller. And we're still twisting away from the arm, retracting our chin to engage our neck flexors. Knees are soft, twisting. One more breath here. And let's move to the other side for our pec major stretch with the arm stretched in a T, soft bend in the elbow. As you twist away with the legs together or hip distance apart if you have back issues, retract your chin so it moves back and you tuck it under on each exhale as you twist deeper. Inhale laterally, pull the belly in towards the spine, lift up on the muscles that stop your stream of pee, fog a mirror. Hear your exhale like you're fogging a mirror like Darth Vader as you twist. Inhale into the side body, brace the abs, exhale to twist. Moving the arm into a V or W position on the wall, changing the stretch to either the pec minor if it's in the W or the anterior delta bicep if it's in the V. And same thing, retract the chin as you twist, opening up the back of the neck, side of the neck, recruiting the front of the neck, soft bend in the elbow if you're in the V position as you twist. We're going to now turn and face the wall, feet hip distance apart, step your dominant leg back first. Deep bend in the front knee, tracking over the second and third metatarsal. Pull the abs in, neutral pelvis, focus up eye level. Driving that back heel down as the pelvis pulls forward. Abs engaged, holding it here. Inhale and exhale, step that leg forward, stepping the opposite leg back. Nice and parallel with that leg. Deep bend in the front knee, tracking over the second and third metatarsal. Reach the chest back towards the shoulder blades. Retract your chin. Keep your focus up eye level. Drive the heel down as the pelvis drives forward. Inhale. Brace the abs. Hear your exhales. We're releasing the gastrocnemius on each side, that outer calf muscle. One more breath. Exhale. Let's go ahead and grab a chair. We're going to set up for a supported lunge chair, hip flexor, psoas stretch. Start with your dominant leg behind you. This will be the harder side. Front foot should be completely grounded on the floor, outer and inner edge. So if it's dangling in the air, put a block under it or a book. And then from here, take the outside arm up, squeezing the quadricep of the back leg, trying to straighten it. Notice all 5 metatarsals are down. You don't have the whole foot down or the heel or arch, just the toes. And we're side bending away. Try to relax the chest back towards the shoulder blades. Plug the shoulders down the back. Keep your chin retracted here. This is a deep, deep stretch. Very challenging postural stretch. I'd encourage you to be here for a full minute. This is going to really change your movement patterns once we open up those overactive hip flexors, allowing you access to your core to flatten your stomach and deepening the work in your butt muscles and hamstrings to give you longer legs and a tighter tush. All right, you're doing great. Inhale laterally. Watch out for the ribs spraying forward. Pull the belly in. Exhale to side bend deeper, squeezing the front of the thigh. Equal weight in both feet, or metatarsals rather. Go ahead and exhale to switch sides, setting up on your second side. Make sure that front foot's fully connected. So are the back metatarsals. Outside arm is up, shoulders are down, chin is retracted. You're going into lateral flexion towards your chair. Watch out for overextending the low back. Just keep the belly in towards the spine and lift up on those muscles that stop your stream of pee. This is going to help tremendously with the back issues, if you have them, by conditioning your transverse abdominis. As you inhale, hear those exhales like Darth Vader. What's happening in your rib cage? Reach the chest back towards the shoulder blades. Make sure that front knee is tracking over the second and third metatarsal. The toes beside the big toe. We consider the big toe the first metatarsal. All right, from here we're going to slowly come out of that. Set the chair to the side, coming back to center. Take a hold of your roller, and you're going to stand in a lunge, putting your back knee down to come down safely. If you have back issues, brace your abs. We're going to roll out our quadriceps, bring our forearms onto the ground, and walking forward and back, keeping the abs tight, neutral pelvis, getting deep into the fascia of the quads. You can play around with external rotation of the legs and parallel legs, finding any spot that needs your attention and holding it there. The quadriceps are an overactive posturally tight area, so we're going to be here for a full minute. Feel free to just hold the position and really put your body weight and pressure into it if there's a spot that needs attention. You can roll back and forth, engaging the abs, working the back as you walk in this plank. If you're not finding spots, I'd encourage you to externally rotate the legs, getting deeper into the groin area where the hip flexors are. That's definitely going to be tight if you have lordosis or kyphotic lordotic posture. One more breath here. Inhale laterally, pull the abs in, lift up on those muscles that stop your stream of pee. Exhale, sustain that lift. Coming off the roller, we're going to now bring our dominant leg. We're going to roll our posterior tibialis, which is medially near the knee, down the tibia bone. You can stay up by the knee, that's usually the sweet spot, or you can roll about halfway down along the tibia bone into that fascia. You can always lift the hips up, pressing into the other leg or into your arm, however you leverage it, to intensify the stretch or the release of the fascia. Do what feels best for you. This is an intense exercise for people that have knee tracking issues. Any alignment issues can cause, especially the pronation. So as you're doing, your sumo squats and lunges and learning to track the knee over the second and third metatarsal, if the knee tracks poorly, not rolling this out can result in knee discomfort. So we really do want to think about the posterior tibialis and the other spot we're going to get in a second as areas to reset our knees when we are learning better movement patterns and conditioning the weak muscles in our body. So before we go to the other side, we're going to take the roller now above the knee immediately. This is a great area to get into because it releases the femur bone back down. So anytime you do cardio or even walking, no matter how high or low impact it is, especially if it's high impact, if you're jumping, you want to reset your femur bone so it's not hiked up and pulling on the back. So as you roll in, I encourage you to play around with internal, external, internal, parallel positioning of that inner thigh area right near the knee to get that sweet spot to release the femur bone down. You can always intensify it by pressing heavier into the roller. And once you've had one more breath, we're going to slowly make our way to the posterior tibialis, rolling on the other side. Remembering that's medially along the tibia bone. I find that the sweet spot's near my knee. Play around with the rotation of the leg. If it's internally or externally rotated, wherever you feel more tender tenderness, that's where you want to be. Push yourself to really stay for this full minute. This is going to really change your range of motion and your movement patterns. It's the combination of strength training, cardio training, and flexibility and balance work that's going to allow you better functional movement and enhance sports performance, as well as prevent injuries. So as you're working here, be mindful of holding the breath. When things hurt, we hold our breath, but try to not do that. Send oxygen to these muscles, allowing them to relax and release. Brace your abs. We're going to reset the position above the knee now medially, getting into our posterior tibialis. As you're rolling above that knee, play around with the positioning. I often find people really, the first couple times they do this, have trouble finding the tender spot. So encourage yourself to explore movement in the leg from the hip socket, internal, external, right by the knee, getting into that fascia. It's really important if you have back issues that you release this area and reset the femur bone so it's not pulling on your low back. Couple more breaths, keeping the chest reaching for the back body, trying not to collapse into the side of the body or the arm that's down, keeping your chin retracted, using the front of the neck. Last breath, brace the abs. From here, we're going to come slowly over to the wall, bringing our legs up the wall. With the legs up the wall, I want you to find a neutral pelvis if you have back issues and tuck the pelvis if you don't. Subtle external rotation to open the legs out to the side with relaxed feet. Once the legs are open, let's externally rotate from the ankle joint, doing circles with our right foot for 10 and 9, away from the body, 8, 7, 6, 5, 4, 3, 2, 1, and reverse the circles. Actually, no, let's do the same circles, eversion, away from the body on the other side for 10, 9, 8, 7. As you're doing them, try to imprint the back ribs, retract your chin, check in with your pelvis. Is it in the proper position? Neutral if you have back issues, tucked if you don't. Finish your last circle. Slowly bring the legs together and make your way off the wall, coming into a comfortable seated position, using the abs to sit up tall, pulling them in towards the spine. Great work.